Hey, Ollie, good to see you again. Thanks for joining us again for this chat. So maybe just give us a little quick intro. Everyone dialing in today.
I'm Ollie Matthews, and I'm a functional medicine practitioner, and really look to help people get the foundations of their health in place. But hopefully that then gets better results with TRT, or even helps people actually delay getting on TRT as well, looking at gut health, sleep, looking at improving brain fog, and then working on the hormones as well.
Amazing.
How about yourself?
So Dr. Johnny Andrews, medical director at TED's Health. We are a tech-enabled men's health clinic. Also got a background working as a medical doctor in the NHS, in the private sector, and have worked for various startups and tech-enabled healthcare services. Big passion is prevention and trying to enable people to live healthier. So, tell us a little bit more about kind of what's been currently topical for you with men's health.
I'm seeing more and more links with the gut health side of things, how people's gut health isn't what it used to be, whether that's exposure to chemicals, like plastics, pollutants, pesticides, but not absorbing nutrients as effectively. And then that's then having a knock-on impact with testosterone, because we know that if we can't absorb the nutrients, we're not going to get the raw materials to actually create not just testosterone, but other hormones further down the line. However, what we then see is people then trying to chuck a probiotic in, or they're thinking, oh, I just need to have some fermented foods. And then they're going around in circles, getting more and more frustrated, more and more bloating, more and more reflux, more and more annoyance as such, and wasting more money than actually if we looked at fixing the root cause, which is usually going to be gut lining, or where is it coming from as well, because digestion starts in your brain and then saliva, right? With mastication, chewing, saliva production, people with dry mouths. And then as well, there's a couple of red flags come up where people have said, I can't swallow pills. And then it tells me, right, we're working with a brain gut axis thing here.
Yeah.
Or maybe that they're constantly getting dry mouth all the time and constantly chewing. People are getting frustrated eating with them, and they end up that they're like having to chew like excessive amounts of time. So we look at saliva production. So if we then start to look straight at the gut rather than up here at stress and vagal tone and everything, we then don't get results if we go down here rather than up here. So it's trying to find that root cause. I think if we had more information about that, if we had more people looking at that, we get so much better results.
I think that's really interesting as well, like what you've described there as well with talking about the brain. And I mean, you could even take it a step further and say the eyes, right?
Yeah.
Which obviously connects straight into the brain, but you see something, right? So typically we see food and probably smell as well. Again, differences on which sense dominates. So most people are more visual, but for some they have a different sense that dominates as well. And there's probably also gender differences as well.
Yeah.
And then there's a bunch of other things as well, like learned behaviors. Behaviors really kind of affect kind of what we, how we sort of process things as well. So that adds an extra layer as well. But it's so fascinating because again, we tend to think of gut issues being, simply limited to that region of the kind of traditional kind of GI tract, but actually that extends all the way up, all the way to the mouth and beyond. And there's lots more. When you think about it, systems interact as well. So I like what you're talking about, kind of axes as well. So gut brain being one, but obviously there's others.
It's like the lung, gut, and there's so many axes.
Yeah.
Is it axis or is it axes? Axi?
Well, now you got me. Axi, maybe axes.
I want an answer for that one.
Axes. Well, it's axis. So in the
I just say axes.
axes, yeah.
But as well, this
it sounds like a rude term, right?
Yeah. It's very much the life that we live in now. We're in a busy world. People are high stressed. Now, if we look at the smell and the vision, like looking at food, and there's that whole cooking your own food, chopping up the onions, putting the spices in, letting the food start to process and start to work over time, building the recipes. But we're in a click your fingers, press a button, and the food's delivered.
Yeah.
So we missed that whole point of actually where the saliva
kind of shortcut of that.
Yeah, we shortcut
it out. Yeah.
And then we have ready meals, and we look at microwave use with plastics in there. I absolutely do use a microwave, and I feel toxin exposure is way higher than we even would think. And I looked at there's some studies that show that newborn babies, toxins are already saturated in their tissues. So it's not we're going to get completely removed from toxins, which are going to then we look at like they're going to really hit the endocrine system and hit other hormones as well. We're not going to completely get rid of toxins, but doing what we can to start getting rid of them as much as possible.
Yeah.
So making sure we're sweating, making sure we're going to the toilet daily, making sure that we are breathing right, exercise, and all this stuff makes a big, big difference, because people forget about that knock-on impact on their testosterone. And we see low testosterone from people that are exposed to chemicals. Then they're getting poor sleep because they're working shift work, for example. So chemical exposure in a factory, working shifts, then they're highly stressed, they're not getting exercise, they're having processed foods because they're really busy. It's a massive cascade into what we would then see as low testosterone. So
Amongst other things. But
yeah.
fundamentally
Exactly.
that's a key one of the axes that are affected. It's funny what you say, because I think we're conditioned in society, just kind of expect a lot of things. Many of these things now that we're kind of are becoming more recognized. So as you speak about kind of environmental impact and toxins and plastics and other things, again, are things that we're taking for granted for convenience. Again, most of us, even for the last 10, 20 years, talk about kind of on-demand delivery, using apps for food ordering, grocery, online booking, deliveries, all that. Most of us have chosen this at some point because it's been an efficiency thing. It just makes our life easier. It allows us to live, to work, busy lives with kids and things like that. Sometimes it's the only option, but there is a trade-off. And I think, it's not only just what's the impact on the environment, but actually what are the impacts on our bodies. And I think we're only starting to appreciate that. But in many ways, the ship sailed there, as you say. So talking about kind of newborns and the impacts on children, I think, thankfully you and I grew up some years back when there was probably less baseline environmental exposure to these things.
Yeah.
But we weren't completely immune to it. And we go generations back, again, there were different things, so you talk about kind of working, factory work and stuff. So industrial revolution, so 100 years back, different types of things that people were exposed to. So I think we've improved certain things. Our awareness of kind of environmental workplace risks are a bit better. Health and safety in the workplace is a bit better for some things, but we've now got a new set of problems to deal with, environmental, and I don't think we've quite adapted there.
I think they're also stacked on top of each other. So we see like our parents and their parents, and there's I don't know the exact numbers, but how their testosterone was a lot higher than our testosterone going into 40s and so forth. But then we look at transgenerational trauma. There's like grandparents that went through a war, maybe even 2 world wars, an aspect. Then like our parents went through their own stresses and different toxin exposure. Then the whole change of industries changing with processing foods, microwave coming around and everything, where that's then piling on generation to generation to generation. And then we look at testosterone and health in general. We look at health, that this is our health right now. And I think we spoke about it before, that I turned 40 this year. My health is made up of 40 years of being on this planet. But not just that, my mum and dad's health, their grandparents' health. And we look at when a woman is born, they have all the eggs they're going to have. So when your mum is born, she's got the egg that's going to be part of you already inside, exposure to those toxins. And it's a lot that's piled on. So when we look at stresses, there's a study as well that shows that survivors of Auschwitz, their grandchildren still have trauma based around that. And there'll no doubt be as well people that survived things like 9/11 and terrorist attacks, the trauma that gets the impact there. So we're then seeing further down the line that, using testosterone as an example, we see impact with testosterone as a result going lower and lower and lower. And earlier and earlier and earlier.
Yeah, totally. I think, there's a couple of interesting, important points maybe to just kind of unpick there a little bit. So I think you summarized it well. So the exact numbers, again, not top of mind for me, but we are well aware that the average male testosterone level has declined over the decades, over the last 50 years. If you were to look at kind of the average 40-year-old or 50-year-old male testosterone level, it has declined. And again, why is that? I think it's not just one thing, it's a multitude of factors, and I think we can all have a hypothesis or best guess. But it's societal impact and how we live. It's probably an element of genetics as well, and adaptation to society and environment. It's kind of general lifestyle, and it's the simple stuff, right? How we eat, how we sleep, the amount of stress that we're exposed to, again, other toxins and things that we now consume, stimulants, etc., alcohol, things that we didn't probably rely on or so dependent on 40, 50 years back. So, and just generally how society's changed as well. So I think that's a really important point, and I think it's really, is one worth highlighting. I also really liked your bringing up kind of trauma, because I was actually at this NHS summit up in Barnsley earlier this month, and the two focus on kind of obesity and women's health, but and kind of with other work I've been doing elsewhere, kind of it was quite interesting. I was involved in the kind of obesity track in the conversation there, and obviously obesity is very topical. GLP-1s is a medical therapy, but it's always been very, very topical at every level. I think fundamentally people are very incentivized to want to lose weight. Society has typically stigmatized people for suffering with obesity or overweight. It's not always been the best regarded or understood health problem, typically because it's multifactorial. It obviously is also comprised of other health issues, either causative or rather secondary to it. Namely like prediabetes and diabetes, and other things are either associated or causative. So it's poorly understood. It's still not necessarily well managed by healthcare systems globally, but it is known to be a public health problem, and it massively is going to impact society. And again, there is a massive relationship with obesity and impact on hormonal health for men and women. But what was interesting was a discussion and someone sharing insights about trauma and actually that big impact. So if you think about, and it's all very logical, if you think about kind of development from childhood onwards, again, a lot of early traumas, and again, was casting the net wide. So any type of trauma, it doesn't have to be any specific type, can influence kind of eating behaviors and habits, which then have an impact on potentially obesity, which then obviously comes with other health issues associated with that. So it's very logical that many things can be attributed to trauma, as you've kind of brought up. One maybe question for you, I'm interested to maybe learn a little bit more about your personal journey as well, and maybe how you feel trauma might have shaped that as well.
Trauma's like massively, massively shaped it because I've spoken about my dad dying when I was 15, but even before that, there was a time at first school where I won't go into the details, but I was abused. And it was around that time I started wanting more sugary, more comfort food. I remember I'd go around my nan's and there would be like the sweet bowl, and like she would have loads of thick butter on bread and all that sort of stuff. And you would eat loads of food and have comfort there. And like, so that hit me quite hard, because then you go into middle school, then people start judging people for being a little bit overweight. And I look at the low testosterone aspect as well. That was getting higher with my body fat levels for obesity. And the sport that I got was like playing FIFA or something like that on the PlayStation, rather than actually going out.
A real sport.
Yeah, I'd do some going out and playing football, but it's more PlayStation and like Nintendo 64 and all these other gaming systems. But I noticed more the trauma hit me. So my dad died when I was 15.
Wow.
And I know 100% that I wouldn't be doing what I'm doing now if my dad was still here, especially with this focus on men's health, knowing that he wasn't overweight, he was stressed out, he had migraines, he was running caravan parks, manager of caravan parks, getting headhunted for different places. And he was going on a course. He was 47 years old. And I actually found out on the Saturday before he died. So he died a week later. He said to his partner, who he had an engagement ring in his bag, so he was going to ask her to marry him. And he said, this job's going to kill me. And a week later, he was dead. And I've said that before multiple times, but he went on a course. He was playing volleyball, got hit around the head, but not enough. If you think like you have to get hit, a professional volleyball player would have to hit you around the head very hard.
Yeah.
This is just amateurs.
Hmm.
Like, and then he had a migraine, which he suffered from migraines. He suffered from sleep issues. You saw the signs of stress in him. Went into hospital, and that migraine turned to a stroke. And then we were told he was going to be okay. But then there was like repercussions and oxygen starved for the brain. And on the Saturday night, 10 to 10, we had to make the decision to turn off his life support machine. So that happened when I was 15. Now that and trauma, but that's like a developmental time, like high developmental time for a child, right?
Yeah.
And
Totally.
there, I remember actually going home. He was in Grantham. I live in Norwich. Going home from that and like literally just staring at the ceiling for like hours on it, just laying on the sofa staring at the ceiling. And I had this kind of link with food beforehand, but it went much, much higher as a result, off the charts, because it was comfort. I remember that there's emotional connections. When we look at food that we are connected to, there'll be an emotional reason for it.
Sure.
And it used to be loads of packets of crisps, because on Saturday nights when I was with my dad, we'd watch Match of the Day. The Match of the Day theme tune would come on, and we'd have like a 6-pack of Walker's crisps between us. Like, it's obvious why I was overweight. I don't know how my dad didn't get overweight, but it's very much like, it was like, is it Pavlov's dog with the bells?
Oh, right. Yeah. Pavlov's.
Pavlov's dog. Yeah. And like, it was like, I would salivate. Like, obviously the digestion was working a little bit okay then, but I'd salivate when I heard Match of the Day theme tune.
Yeah.
And one
Just like the jingle. And
yeah, exactly.
Yeah.
But it's interesting going from that trauma, because then I found fitness. Started getting into the gym. Back in the day when you used to have your like Maxi Muscle Cyclone or whatever there was at the time, and I'd go and grab that. I think I started with like Slim Fast or something.
Right.
And I was really overweight. I'm talking like 100 pounds overweight. And in about 18 months, I dropped that and competed in bodybuilding. But it was finding something I could control. No one else was in control when I went into bodybuilding. And I look back and like, I totally lost control when I lost my dad. That was trauma that pushed me into bodybuilding to say, look, I've now got control. No one can put food in my mouth. No one can dictate how hard I exercise. My whole life was bodybuilding. I'd done my first show, and I was in a relationship then, ended up splitting up with a person, and like every single thing, every single gram of food was then tracked. Every single workout was written. I haven't got them now, but I wrote all my workouts down. My whole life was bodybuilding, but that was control. And it was an obsession over it. I would never tell someone to do that now. Never even dream of competing now. But it was also that control. When I look at my actual upbringing, also being in a room with mold and stuff, like, it was obvious I had low testosterone. Going into competing naturally and then using other stuff as a result. Done 7 shows, and one of them, but I used stuff for. But a lot of that came from trauma. And I felt as well that trauma then pushed me into, like, what can I do with my body? It then becomes self-harm as well, pushing yourself, like ridiculously smashing yourself. There's a lot of demons when you look at people in the gym. Sure. And I can't be angry when I train now. I've tried it. I've like, tried to squat. You get 200k on your back. Like, you need a little bit of anger there. And it's like, I'm not angry when I do it now. And it's like, I used to go before and I'd be the person screaming. Now I like cringe with like when people are screaming really loud, but I also understand that they're going through things.
Yeah.
And like, you'd have to get like really angry when you've done that stuff. And so much of that came from trauma.
Yeah.
And I wonder as well, how much of that trauma then had that impact on my testosterone levels, because the trauma was pre-puberty.
Yeah.
Obesity came through puberty. And then at 15, you're still essentially going through it as such, depending on when you started and so forth. But that's a massive developmental, not just hormones, but also neurologically. Is it like 25 when your brain is
Yeah.
fully developed.
Yeah.
So you still got 10 years of building your brain. I started competing. I started losing the weight when I was like 21 and competed at just before 23. So there's like that whole 10-year period of, well, longer, that massive developmental stage. And
With
how many
everything
people,
else that you're going through as
everything
well.
else you're going through. And again, like, it's not just trauma of losing the parent. It's like of being
Which is
sexually
huge.
abused, whatever it is.
It's
It's massive. It's the biggest thing that anyone could go through, I feel, at a young age. But people are going through different perceptions that become traumatic. And that could be a relationship breakup. There could be seeing people with PTSD because they've been pushed down like a performance-based route with athletics or running, eating disorders, exams. There's trauma all over the place.
Yeah.
And I don't want to use the word trauma like just chuck it around willy-nilly. It's like,
Absolutely.
basically, we want to make sure that people understand that PTSD, whether I have or have not got or had PTSD or whatever, isn't just when we look at people that have, like, I'm grateful for people serving the country and being like on the warfield and looking in the military. It isn't just that.
Yeah.
When people have PTSD. And
Although
I think,
commonly, or rather incorrectly, often incorrectly, labeled as only being that. And I think you're right. Oh, yeah, that's definitely a very fundamental.
but I think
thing
also
that
that's what sometimes stops guys from talking as much.
Mhm.
Do you not feel that as well?
Yeah, totally. I mean, firstly, so much to unpack there, and I think thank you for like sharing that, and that opening up about that, so transparently. Like it's I think really encouraging, and hopefully for anyone sort of listening, probably will resonate. I mean, I think a lot of kind of very big and serious topics there that I can sadly don't get spoken about enough. So thank you for sharing that. And really sorry for everything that you went through. I mean, that cannot have been easy, and I think we can't just brush about. It's easy, perhaps easier now to talk about it some years down the line, but I appreciate that
I
kind of
think as well, just like
to
right in there with that, is that we had a little discussion about, like, why do we do what we do? That's why I do what I do.
that's
And
why.
if, as I said, if my dad was here, I wouldn't be doing that. But also, like, that's why I aim to put as much free content out. But it's also why I built a business around it. Of like, let's change those negative into positives, to say, let's use my dad's life for a positive to make sure another 15-year-old doesn't lose their dad. And being a dad now myself is like making sure I'm growing old to see hopefully grandkids further down the line.
Yeah, amazing. Well, I think that thank you for all that you do, and I think there are numerous examples, famous examples as well as sort of general everyday people who have gone into a career or a vacation healthcare. There are elements of that even in my story where there is a why that is answered, or purpose which is answered because of a story like that. And I think when there are some slightly extremer examples where with the loss of someone pivotal or key, a family member or otherwise, that really does influence someone, nudges them. And I think it's quite, I've seen a few instances in my own journey with kind of healthcare, and it's so tempting to want to do other things, and life is tough and you explore other things, but coming back to it, I mean, obviously it's, for me, it's also the interaction with patients, and you get, you feel that and feel value when people, you can impact someone's health or life for the better, and that's always very rewarding, and that kind of reconfirms that. But it's also, there are reminders being or drivers, and you think back to earlier memories or events being so pivotal, that really goes, well, I want to do this because I don't want other people to either experience that, or I want to be able to try and help other people in a similar situation. And I think, there's so much there that you've shared. Um, so I mean, I'm keen to maybe also explore a few of those themes. So you mentioned obviously, you know, your 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 background, and that 10 years being very transformative. You've spoken about kind of even the environment, and saying, the room having mold being an aspect. And I know it's interesting, isn't it? Hindsight bias. You say, well, obviously I had low testosterone. I mean, it might not have been obvious then, though, obviously, and we can't
Yeah.
know now without looking, can't go back in time and do the diagnostics. But obviously now there's enough there of a narrative, and I'm always curious as to. I say this to patients all the time. I am very quick to see where there could be potential causality, but not confirm or want to put my hat on one thing, because I always see things as multifactorial, and also, so there's a lot of maybes, but we can't definitively ever say something. And I think it's important that people also know this. People come with blood work and say, well, look, that's the proof. And it might be for a snapshot in time, but it's not always the whole story. And I think that's why it's important to pair the history, literally his story, if you take that word apart. So what people say, which, as clinicians and as coaches, and we have that conversation with other findings, be that as a clinician examining a patient physically, or diagnostics, investigations, and things like that, and not just looking at things in silo. I think. Well, what's your thoughts on that, as someone who works very holistically, looks at and thinks about the systems, looks at the story? How important is that versus someone coming to you and saying, "Hey, Ollie, I've these are my bloods.
Yeah, I mean,
What do you think I should do
it's
about it?"
piecing every piece of the puzzle together. And if we just take a blood test, and even if we look at, like, they've come to us and they've got their total testosterone from standard doctors or something, they said it's low, and that's only going to say a piece of what we need to actually see. Being born in the 80s and then growing up in the 90s, I always remember the catchphrase, and you had Mr. Chips with the super catchphrase, and they'd reveal one square of it. I always say that we need to get the whole catchphrase reveals before we even start to guess at what's going on. Well, not guess, but
Yeah.
if we've only got one square revealed, we might get it right. Chances are we're not. Like, you may get it right, but chances are you're not going to get it right if you've only got one of the squares revealed. So it's not just looking at the bloods, and it's looking at their lifestyle history as well. What are their symptoms saying? Because someone could literally have 0 symptoms of gut issues that we stereotypically think are gut issues. You're bloating, constipation, diarrhea, whatever those things are. But they've got absorption issues which aren't really showing, apart from when you look at their bloods for testosterone or thyroid or whatever, or conversion from 3T4 to 3T3, for example. So that's where starting to know the patient and speaking to the patient and looking at what their lifestyle intertwines with, like, what is their history, what is their travel history. Had someone yesterday, and like, she's got some hormone issues, but she'd spent, like, I think it was like 10 years in Thailand, and then 10 years before traveling around, like, really much further afield. So we have to take all that into account.
Yeah.
I think that's one thing why I absolutely love the one-to-one aspect. Group programs will work, but I feel there's got to be some individualization of what is their history. And it's also one of the things that people get frustrated at the NHS. But as we spoke about before, if I had like 10 minutes with someone, I am not going to get anywhere. Or less, yeah. And I'm not going to get anywhere with that person. Some of the times it's people have given you their questionnaire, you've asked some questions, then you go to give their supplement on like the second call, and we said about the not swallowing supplements. Oh, can you give us powder or liquid form supplements? So you struggle with swallowing supplements. Right, that gives us an idea. We need to just switch things a little bit. Let's do some vagus nerve work. Let's start stimulating the vagus nerve a bit more. Let's work on your brain function. Let's work on any exposure to chemicals that are actually still going on. And we need everything to be put into context.
Yeah.
And it's if we look at text messages as well, text message or a voice note, you're going to get more from a voice note because you're going to hear like people's phrasing and their tone, rather than a text message that someone's put the wrong punctuation or something at the end, or one of the people that puts like 10 exclamation marks at the end of every message, like, why are you constantly shouting at me? Yeah, exactly.
Okay.
Yeah. So it's everything needs to be put into context. And when it comes to health, we're in a society that attention span is getting lower and lower and lower.
Yeah.
When we look at reels, and people want it quicker reels, they want shorter reels, they want to be told that's what's going on.
Yeah.
Unfortunately, that's not going to work. We need to look at things in context.
Yeah, I think there's, again, so much to unpick there, and probably more than we can cover easily in this format. But I mean, it's I think context is key, right?
Yeah.
So I'm very much in agreement with that. And I think more time to spend with with patients, and I think there is so much to piece together. I really like the analogy with text and, text-based versus voice.
Yeah.
I mean, voice as a modality is fascinating. I don't know if whether you've explored or seen and or heard of any of the research and companies and startups that are exploring voice. Like there's companies I've even been kind of speaking with in other in a previous life, using coughs as a diagnostic
Okay.
metric, or even voice recordings in journals, and kind of tracking that over time, so longitudinal, and seeing that where there may be variants that could actually tell or inform about a person's mental health. So potentially being able to, again, with machine learning, identify where people might be at risk of certain mental health issues
Yeah.
based on their voice alone.
Wow.
Completely fascinating. So it's actually a new biomarker. Voice.
Are they having to have some symptoms where people come to them to say about mental health?
So, I mean, in truth, I think at least the ones that I've explored previously, they're all in a kind of research phase, R&D, but it's not going to be hard or long before people start pairing this together. So, clinicians who are trained with this, using it as as an adjunct. So, I mean, I think we talk about like, kind of breadcrumbs that people leave, right? So like hackers are very good at this. They can tell from the style of how people type, they would be able to identify a person, which is pretty crazy. So everyone has a start, just like we have a way that we walk, a posture, a certain mannerism or not. That can be even detected if you've got enough volume. If someone was to study my entire WhatsApp or and text history, I'm sure they'd probably know the way I write and start,
Yeah.
and punctuations, just like the 10 exclamation mark, and what maybe that can infer about my personality or other things. I don't know really, but I'm interested to see in the future. Again, this is where I may be able to help or maybe harm. What that might mean for health. I think there's an awful lot of data that we have just on our phones and our devices. I mean, again, we talk about kind of wearables and metrics that we track. So, how we sleep, step counts, and other things. But there is a lot of other stuff just like that. We spoke about, voice notes, styles of writing, tones, etc., that probably give a lot more away about our potential, you know, mental health or potentially even our physical health, and our habits as well, again, which do influence, our day-to-day health.
It's a big one. And
But,
I think as well, when we look at metrics or data that we do have, we have to actually be open to using it. How many times have you spoke to someone and they've got a Whoop, an Aura, or whatever it is, and you're like, oh, well, that's telling you that you are stressed out. Why has it been telling you for 6 months and you're only doing something about it now? You look at their HRV and it's just really low. I've noticed actually that when people come and they say, oh, but my HRV is balanced. That's balanced low. But
right.
some of these technology that because it's not going up and down,
Yeah.
it's balanced like in the teens. I'm like, yeah, we want it to get much higher. Like ideally, I want HRV. I don't know where you would like it to be, but I want it to be above 60, like most of the time, unless you know why it's low for individual days on average over the day. And people are coming like, yeah, but it's saying HRV is balanced. Yeah, but it's super, super stressed out. And we've also got bodies that have been so stressed out, it's seeing it as normal.
Yeah.
So they never actually
And
feel
that's their
stressed unless they
baseline.
stop. Yeah, it's their baseline. And then they stop and then they feel even more stressed out because they've stopped. And they're just constantly just working on like adrenal overload. I don't want to use the term adrenal fatigue, but
Yeah.
like it's their adrenals aren't signaling as effectively because they're just constantly stressed.
Yeah.
And I do a lot of Dutch tests for people, but then I add the cortisol awakening response on. And I say to people, your cortisol is low. That's a good thing. No. Your cortisol is low that we need a hit of cortisol in the morning and then lower in the evening.
Yeah.
And it's just flat.
Right.
So they're waking up, they're feeling flat. And I feel as well, yes, testosterone is going to help if they've got deficiencies in testosterone, but we still need to work on the adrenal response as well.
Yeah. Yeah.
And then you look at DHEA levels as well. If then DHEA is screwed, then if we sort that would help with testosterone as well. And so again, looking into things in context and actually using the data.
Yeah. I think that what's quite interesting is, I mean, look, wearables have been around for a while, and I think people have been kind of aware of that. But again, it's not something we've had all our lives.
No.
And so many of us don't really know what our baseline is. And, you might be lucky enough to be in the average and be normal and potentially, you might be an outlier, and for reasons you've said, not know that because you've only started wearing for 6 months, and so it's always been kind of a baseline of low, but that actually isn't normal
Yeah.
or whatever. So I think it's, again, talking about that kind of that longitudinal element, right? So being able to know a deep, rich history, piece together lots of things, not just only wearable data or biochemical data or just what is told symptom wise, and which is again often with people's own opinion as well. So being able to pull all those pieces out, I think, as you say, to uncover, like you said earlier, it's a bit of it's detective work, really, isn't it?
Yeah. And also what they've been told, because you must have people that come to you and they look at their labs and their testosterone's at like 18, 19, and they've got zero symptoms of low testosterone, but they've been told by someone at the gym, you need to be at like 27, 28 total testosterone.
Yeah.
Well, you feel good. You're sleeping well, but you have no problems with erectile dysfunction, no visible health issues, no anxiety or anything like that, no low moods. Why do you want to boost it up? It's like we've got this into our heads, we have to have as high a number, but when someone's pretty much got zero symptoms,
Yeah.
what would you do in that case?
I think, it's funny, and you'll probably take from a lot of my answers that I'm being deliberately quite broad and vague. And there's a reason for that, because I'm being very careful to not be giving advice that someone might take personally.
Yeah.
Because again, if we get on a call one to one and you're the patient, it's going to be much more personalized and I'll be much more deliberate with what I say and but specific to you or whoever that person is. So I think you can do that in a one to one setting, right? In a consult, which is what I do. But when we're speaking broad and talking to you know, a whole demographic, which encompasses all ages, etc., background, medical history, genetics, medication, supplements, etc. How it's we can't be we can't really cover everything. So you covered a lot of the symptoms, but that's not everything. And
Yeah.
interestingly, I say that because people will come and say, actually, I don't have these common ones, but they might have something else. It might not even be the one that they're so familiar with. I have a lot of people who say they come talking about some of the sexual side effects, but they might also use kind of euphemisms because again, there's the stigma associated with that. And often that implies that they've really been putting things off and they've waited and tried everything else. And
Yeah.
now they're like, oh, okay, now because this narrative is again now everywhere or seemingly everywhere, on social media and everything. Now they feel a bit more comfortable to talk about it. But actually, it might have been, one of the first things that they had, but there might also be other things. I mean, I also have it where you talk about that, you go further, and actually they're like, "Oh, I didn't really realize about it could actually affect my kind of my mental health or my cognitive function or
Brain
whatever."
constructing.
Yeah, so I think it's so far reaching. I mean, frankly, these hormones can affect all our systems, and I think maybe we've not even uncovered all the potential symptoms. So it's such a personal thing. I've kind of now forgotten the actual question you did ask me before that.
It was about like the symptoms, but it's interesting we talk about symptoms. So when I spoke about there's a symptom I didn't realize was linked with low testosterone
Which
and
one? Sorry, which symptom?
dry eyes.
Oh, dry eyes.
It's like
Okay.
his testosterone will stimulate the
Okay.
tinnitus. I
Yeah.
didn't know that until I went through that and was like, why am I having to put drops in like 4 or 5 times a day? It wasn't prime hay fever season or anything. And so I couldn't link it with that. And this is when I actually came off TRT when I was going through the fertility process and so
Hmm.
forth. But where my testosterone dropped so extreme, I just spoke before, like 2.4, then 1.1, and like just hovering around those
Yeah.
areas. I didn't realize that that was one of the symptoms until I went through that. So this is someone that's still like, I know a lot about testosterone. That's my primary area,
Mm.
but that was still a symptom I didn't even link with that until I went through it myself. Okay, that was a few years ago now, but
Yeah.
yeah, it's interesting to see so many, and that could have also been low estrogen as well, I suppose, the links with that. But it's definitely one of the
Interesting.
unknown, more
Yeah. I mean, it's definitely
unknown
it's
symptoms.
not something I've commonly ever heard or seen, but I can definitely see where that could be attributed. But I think, like all things, again, I mean, that's a personal experience for you. That's very
Yeah,
strong, and that was obviously very noticeable. We again, will typically the things that come to mind for you and I are what people commonly report, right? So
Yep.
what the patients report has their symptoms. And again, we look at the average person and they typically report the same things. But there's a small subset that will have other things. And again, we might not necessarily have drawn those correlations. So I think it's fascinating. I think one of the key take home messages are that there could be many things. It's important to speak about it. So when speaking to, you know, a clinician, it's important to share that. And I think that's one of the things the conversation opens up, doesn't it? How do you find when you start having a conversation with someone to try and get them to open up about their symptoms? So for me, I'll just say, people just go with a couple of things. They say, "Oh yeah, just feeling low energy, low mood. I thought it might be this. I saw an ad, I read this article, I saw whatever, thought it might be this." How about you? How do you find people tend to share their stories and their symptoms?
It's trying to build up trust with them, and they start to share more and more of what's going on in their day-to-day life. But the process I have is that they might see one of my reels, they'll send a message, we have a couple of conversations back and forth, or a couple of messages back and forth, and then I say, look, do you want to get on a call? It's much easier to get on a call face to face on Zoom. Hopefully they're in a place where they can concentrate. And when we get on that call, we get more trust built up.
Mhm.
We're in a world so much where there's just AI left, right, and center. I use AI in my business. Like, I think it's a bit silly if we don't use AI in our business. We're going to get left behind. But there's something about when you get onto a face-to-face call with someone and they can see that the person behind the reels is actually there,
Mm.
and you're chatting to them and they know that they've got your full attention,
Yep.
and they start to trust you more and more and more
Totally.
and more.
Yeah.
And it may take a while for people to actually do that. I've
To
had,
open up and share.
well, yeah, I had someone sign up last week and he'd been following me for 6 months before he got on a call, but he's built up that trust. And do you know one thing that, and we've done it so much already on this recording already, is that me sharing my personal story. If I went out there and was like, hey, I'm not going for any of this stuff, I'm just like just going to the gym, getting it done, all this sort of thing, actually talking about losing my dad, talking about having low testosterone, talking about being obese, talking about autism, ADHD, and all the things I've been through, whatever it is, trauma and everything, it helps people realize that I am a real person,
Yeah.
and that I've gone through these things. I'm still learning. We're all still learning, but I can then start to see what they are going through. And then they start to realize they're not alone. So they're much better at opening up and knowing that they're not going to be judged. I'm not here to judge
Totally.
anyone.
Yeah, I think that's really important. I think I can't echo that enough. I think it's so we have this disconnect, right? Because many people have labels or associate certain terms or conditions with a certain, look of a person and so to have, what people might see you as just being someone who seemingly looks very healthy and fit and has everything, figured out, who is now, coaching people, they'd assume that there isn't any, there can't be any of this kind of history. And actually, it's really refreshing to hear that about your
Mhm.
story. And I think all those different pieces that you mentioned, which do have interrelations as well. I think it's really, it's I think it's really admirable for you to be open and sharing. You don't have to do that, to be able to do what you do, even for what I do. I don't have to share my personal insights or takes, but I have done that in numerous settings, outside of even kind of testosterone TRT consults, even in the NHS urgent care. I do share stories about this or that, or this person had this injury or had that. And I think that really adds something. When someone goes, oh, okay, or I take this medication or I have used this, you might find it better to do it this, or I do it like that. That's so much better than
It feels trust.
something you can just find, from Googling and reading about. That's quite stale and quite generic. It's not personalized. So I think the personalized element is so important, and hopefully that's what people are hearing and seeing, that they hopefully resonate with kind of the themes that we're discussing. So yeah, really appreciate obviously you sharing all that. What do you think is kind of the next step for people who are on the fence? They're listening to all of this. They're kind of where do you suggest people begin?
I think people should be getting their bloods done regularly, at least annually. if not every 6 months. I wish I had my bloods done for like years in records. I didn't. And so hence why I'm never going to know what my actual testosterone was before I went down the route of competing and using steroids and then coming off and then knowing I did have low testosterone and so forth. But get yourself checked out. Like, it doesn't cost much to do bloods. Probably spend a lot more per month on takeaways, on alcohol and all this stuff, the stuff that ends up numbing us as such. But actually, we do something and we're more proactive with our health. And we know, is it going up? Is it going down? We can then stop it getting really bad. Don't wait until you feel ridiculously rubbish before you do something about it. Actually, stop that decline in your health and pull yourself back up, because it's going to be much easier to do something if you've gone from, say, 18 testosterone, and again, just using the total testosterone here, there's a lot more context to go into, but like 18 to 15. Chances are you're going to be able to pull that back up a lot quicker unless you've been through something like physically going on. Rather than 18, you actually get a test when you start to feel really bad because you've been pushing it off and pushing it off because we are stubborn guys.
Yeah.
And then it gets to 8. Actually, if I'd have done something and just stopped that decline, I could have kept it up a lot higher, because it's going to be so much harder. Like, if you even do get back up to those levels when you get to 8, that, yeah, we're going to have to use something like TRT in most cases. I just think it makes so much difference to just keep getting checked over and over again. And don't be worried about doing bloods and there's nothing wrong, because that's just as positive as doing some bloods and finding loads of things wrong. People sometimes say,
maybe better, right?
Yeah,
It's the confirmation,
exactly.
piece that
Confirmation, right?
Yeah.
We want to do bloods to rule things out as to rule things in.
Yeah.
And sometimes I've done tests with people like, oh, is that all that's going on? I'm like, yeah, I spent £200 to do that. Yeah, but there's nothing seriously wrong where you'd have to take months to actually fix. And too many of us guys just don't do that.
Yeah, I think you've hit the nail on the head there. I mean, there's, for obvious reasons, so, as a clinician who's spent a lot of time in the NHS, there is this this kind of understanding that, all of this ends up getting dumped on the NHS, so we don't want to be doing more testing than we should. And I think society is shifting, and maybe we're not still there yet, where again, a lot of people do private tests and are left, depending on where they go and what kind of support they have access to. And maybe also, again, depending on costs as well, people feel priced out and they feel, oh, I've got this, now what?
Yeah.
And then it creates anxiety, and then they end up going to see their GP, who possibly doesn't even have the time, and is obviously very frustrated, and then it turns out to be normal or it gets repeated. So there is a lot of that.
Yeah.
But I think fundamentally what you're describing, so, regular testing, I mean, it can only be a good thing in the long term. I mean, yes, there will be, sadly, instances where there are errors or something does get repeated actually, and it turns out that it was incorrect the first time around. There is always going to be that. But, for every kind of story like that, there's also a story where it's the other way around. So I think it is important to change that culture where traditionally, again, typically because of the NHS and systems, we go to healthcare from a reactive need, right? I think I've got a problem, therefore let's now get the test. The clinician orders the test. But we're now moving to society which is more proactive, preventative, right? And the only way you can do that is by getting that baseline. So as you say, unless you have years worth of longitudinal data tracking things over time, how can we know? I think for people listening as well, you speak about levels like 18 and 15. What's kind of sometimes a bit funny, but also a bit frustrating, and I wonder whether you share this, is hearing people, and I've seen and heard it in different contexts, people say, oh, I know my levels for this, or my level must be this. And you go, well, have you had a test? And then like, no, never had a test. So you're like, what are you basing that on? And it's just kind of a gut feel, And people always say, rightly, it's my body. There's that element of agency and whatever, like, I think I know my body better than you. I've only met you for 10 minutes and you're trying to tell me about my body. I find that always kind of quite an interesting point, What's your thoughts on that? Where people say, I know it must be this. And you go, well, actually, have you got anything to back it up? And then, actually, no, I've not even done the test yet.
It's frustrating, but also I understand why. And we look at the amount of stuff on social media, the amount of people that are just focusing on this. There's low testosterone here and there. And they've got the symptoms of low testosterone, and it turns out to be thyroid issues. But there's very similar crossover symptoms.
Yeah.
But it's like, okay,
and other things as well. But yeah,
like very much like just picking one of the things out.
Yes, of course. Yeah.
But again, it's trying to promote the testing to them without trying to sell it. Like, okay, why do you think it is? Symptoms and so forth. Have you looked at getting some actual testing? Because that will tell you at least where you absolutely do need to improve or work on, rather than guessing. Because longer term, you might be literally going around in circles for like 2-3 years trying to improve testosterone, and it's not testosterone. So you do all these, and you make things worse, because then you think, I need to go on TRT. You go through someone at the gym, an underground lab, you don't need that TRT, and now you're stuck on TRT.
Yeah.
Because you've shut down your LH and FSH. So you can come off because you didn't need it in the first place, but it's going to be ridiculous.
It's going to be a process, and it's not going to be
as someone that's been through that process and it didn't come back up. So it's very much, let's find out, let's stop guessing. Unfortunately, so many guys are still going to do that no matter what we say, but it's hoping that I can have built up that trust so they know that I'm not going to just sell them a test for the sake of selling a test, that there's going to be a reason. Let's look at that reason and let's find out 100%, is it this or that?
Yeah, I love the approach. You mentioned underground labs. I'm keen to get your thoughts a bit more. So UGLs, I mean, there are people, of course, who are obtaining TRT from a UGL. What would be your message to people who have been taking TRT that they've sourced elsewhere without any of the checks?
I was going to say, well, I used an underground lab, like, just hands up with that. But I would get my bloods done regularly, and I never switched around different labs. I used the same person all the time until I went with different labs, and now my TRT is with Tet Health. The amount of people that are doing TRT, and we're spoken about it, and it's not TRT. It's literally constant blast, not even blast and cruise, constant blast on steroids. And they're saying, and they're using these labs, people putting in like 1-2 mil a week. I'm like, no, that's not TRT. But if they are doing TRT, and I understand why, because of the price, it is a lot lower, still do your bloods. Still look and do your research on what needs to be done. But one of the things that is very, very tempting when you have this dose of testosterone is putting in more. You've got this dose that you can have, and it's a lot lower price. You can put in more. And it's also tempting not to do your bloods. I'll put it off for a couple of weeks because it's not payday or something. You can just then, before you know it,
people just assume it's not important, right?
Yeah, exactly. But it's not just your testosterone levels, that where other things going on there. Where is your free testosterone rather than total testosterone? All the other things that we need to look into. And like, what's your HDL like? Has that dipped because of the TRT? Look at red blood cells and everything. Like, what are all the things that are going on? I would have everyone go through a private lab if the money was there, and like, hopefully people will see this and know it's not just sell, that they can get investigation done. They can go through an actual doctor, because having that third person looking in, whether it is a doctor, whether it's a coach, or whatever it is, someone that's knowledgeable, that allows you to kind of get a bit of accountability on making sure you're not giving into that temptation, because that's where the serious side effects happen.
Yeah, I think that's an important message. I mean, I think, obviously as a clinician, it's not something I promote, and definitely trying to actually encourage people to not go to kind of UGLs and go through regulated providers, go through proper channels for many reasons. I think you've touched on some of those. I mean, firstly, if you're obtaining something from a UGL, how can you necessarily, actually know what is in it? Now, I appreciate there might be a spectrum of kind of labs, but again, truthfully, do they necessarily have the same sort of rigor and process and sterility?
Yeah.
Is it safe fundamentally?
Yeah.
And I think that's a key thing.
It's scary looking back that I used it, and you're like, wow, like, that was worrying.
Yeah. Do you ever, at the time, were there any concerns or risks or kind of red flags that you had? Or were there things that you kind of brushed past and ignored because, again, you were
I think when I used steroids, shall we say, when I competed in bodybuilding and used for that show in a couple of years, I would ignore those things. And that would be even ignoring like the side effects and stuff that, a trend, master on all these other things. But it was then because I then knew the guy that was making it, and he was so paranoid about everything going on, that I trusted it. And because I'd done bloods, I knew that same amount was getting me roughly the same amount in
so you were
bloods.
tracking it, you had a bit of a trust, there was that kind of relationship element that you described earlier.
the amount of times I know when I've had people that, like friends that have got stuff from other people, they've had the same quote unquote dealer, shall we say, and they've got different labs each time. They're not getting direct from that person. And that's when it gets worrying, because you might use one lab one day, the next week you get what is supposed to be testosterone cypionate or NF8 or whatever it is, and it's a different lab and it's a different concentrate. And maybe it's actually 300 rather than 250 or 200, and the person doesn't realize that. So rather than putting in 0.5 mil and it's 100, it's now 150. And that's when it gets worrying. But we need to know a bit more of the medical background if we truly want to have TRT. And as well, something to take into account, I weighed myself the other day, I was like 96 kilos. When I used and competed in 2012, I was 72.4 kilos. Like, that was a competition at that stage. But I've put on more muscle and am healthier and leaner being on TRT than I was really on cycles. And people could say, yes, there was disordered eating and stuff in there as well, but this is about overall health for me now. Going into my 40s, that's the thing that makes a difference.
Because you're actually more consistent, you're now following something that is a bit more structured process.
Yeah, where testosterone is supposed to be in the body, right?
Yeah.
If we go super physiologically high, that's when we get a lot of side effects and loads of anxiety kicks in, or whatever else it is that goes on.
Yeah. And I think something you've shared with me before is it can be incredibly hard to stop that or come down because of how you're feeling on that, right?
Yeah.
Again, what would you say to people who might be currently sort of experiencing that at the moment?
They know deep down that it's not good for them.
Hmm.
And until they're ready to actually come down, chances are they won't do it. Now, whether they have to have some serious health thing happen or whatever it is, then hopefully they don't. But I wouldn't have changed until it was the right time to change. And it was at the time. Thankfully, I'm grateful for that. And I'm in a much better place for it. So hopefully people can build up the trust. I've had people come to me that have been on cycles and they can't really go like to the doctor about it because there's like the judgment side and things, and it's helping them support coming off. And it's taken time, and something that I had to come off, as I said, for fertility reasons. That was from being on TRT, not from cycles, from TRT. So steady levels to, as we said, like pretty much no testosterone in the system. It was horrible. I wouldn't wish that on my worst enemy as such. It was that it's scary to think that someone may have to go through that, and there's no given period that, yes, I used functional medicine, I used all my knowledge to get my numbers back up to free sperm within 6 months, or numbers came up on my sperm count within 6 months and we froze within 9 months. And my daughter turns 1 on Saturday, which is ridiculously nuts. Yeah. But like, that's not given that someone's going to get their numbers to those levels if it's for fertility purpose to then get back on TRT, or someone's going to be off steroids, shall we say, and then their numbers come back to normal testosterone levels. How are they actually going to feel? And have they done other damage to other things going on in their body? Keep mentioning thyroid, cholesterol, liver, kidney, whatever it is. If they've started using orals rather than just using injectables, there's going to be a lot to unravel. And again, it's hard to say piece by piece, but
Of course.
yeah, I would not want to go back to that period. I'm glad my testosterone's in a good place. And I know, full like hand on heart, that there's a microphone there.
Microphone?
Yeah, hand on microphone, that I would not be doing high levels ever again in my life. People say never, but I'm saying never. There's no need to do that.
Appreciate you sharing that journey as well. And I think, you know, one thing for me to kind of add on that is, as a clinician, it's kind of really something that's always reaffirmed the importance to, you know, never come across judgmental. And I think come across, because I genuinely do not want to, aren't judging people for anything. I'm not just talking about steroid use. I'm just talking generally when I see people in, you know, in A&E, urgent care, etc., coming in with any and all sorts of things. And I think people do value that. But I think that trust factor is really key. I think one of the reasons that people often put off going to see a doctor, book an appointment, wanting to have a consult or even explore something, is because they're worried about being judged, stigma, being told off, all these sorts of things. You know, we have such weird kind of associations. It's a bit like with a dentist, you know, people say, oh, it's going to be painful or this or that. Again, all these things that we need to challenge, I think, and try and change those relationships to.
I remember that time, and I tried to get the TRT on like with endocrinologists for the NHS, and when I eventually got an appointment, like, well, you shouldn't have done steroids. Like, I know that, and I'm appreciative of that, but these are my numbers after being off for a long while. But can we do that before I go back with a private clinic? And it was horrible to go in there. As someone that has like RSD from autism as well, like rejection sensitivity disorder, I was worried going in. I was literally sweating going in, knowing that they're going to judge you. And then she goes in, like, you shouldn't have done this. Well, you're going to have to be off for 2 years before we'll even consider getting you on here, which we know that would have been test Navido, not the best form in my eyes of doing TRT,
Fair.
but that's what it would have been because that's what they do on the NHS. But to have that, so like, I was looked at more like I'd gone in there, and I think actually I'd have been looked at better going in. And again, this is not being judgmental with people, but if I'd have gone in being a big heroin addict or cocaine addict or something like recreational drugs as such,
Yeah,
then I probably would have been treated a lot better.
differently. Yeah.
But because testosterone, like, even though that was a TRT dose, has historically got that steroid connotation there, it was that you're just doing it to look big.
Yeah.
And it was a lot more mental health aspect.
Mm.
Muscles came along with it, but it was more about getting your confidence up, which didn't come from muscles, that came from working up here.
Of course.
And
Yeah.
if I'd have followed those guidelines, as I've said last time we spoke, is that I don't feel my daughter would have a dad. I would have done something stupid, and I'm super, super grateful that I'm able to be with a clinic to support it, and to now have steady levels of testosterone, that we can do standard checks. And like, once your levels are steady on testosterone, you can optimize in so many other areas as well. And that's a discussion for another day when we look at peptides and stuff. So as I said, it's the worst feeling I've ever had. The feeling of basically knowing that I need my brain to function and I've got severe brain fog. I would wake up and my moods were so low I didn't want to get out of bed. I would wake up and I would just be crying. Luckily, I've got a supportive wife, but we were also going through the process of trying to have a child. So when you're trying to have a child and you're trying to do it before IVF, and that if like anyone's like look to have children and you look at that cycle date that your wife's going, is like, there's ovulation, right? I've got to perform now. And it wasn't a case of like, you couldn't just take Viagra, you couldn't just take Cialis and just have loads of response because your testosterone was that low. It wasn't just about that. It was about feeling up for it. And it was just ridiculously horrible. And honestly, that I had a great community around me that we've discussed about before, which helped build me up. But I can see why there was that potential judgment of having low testosterone, especially being an occupation that I'm in. But that whole, wow, well, I have done this to myself, potentially, because I didn't have the bloods from beforehand, but have done this to myself. I never want to go through that period again. I never want to go through low testosterone. I never want to, if there's something I can do to stop people going through that, I would do it for any person, because no man deserves to go through that.
Ollie, I think we covered a lot, and I really appreciate you sharing your journey and some of the more vulnerable things. But I think so much really valuable, insightful reflections that you've shared. So thank you for that. Thank you for your time, and I really
Thank you
look
for having
forward
me.
to another one.
Yeah, I'm definitely looking forward to chatting more about it.